you said that sickle cell disease, the basic thing is that the red blood cells are rigid and they don't bend easily. And that is what causes all the problems that you have described: increased infection, low blood levels. Their blood cells tend to break down faster. So how does a red blood cell just become rigid? What makes red blood cells in sickle cell disease rigid? In very simple terms.
Okay, that's a good question, Sarah. So we call certain things called triggers. Okay, so normally cells are not rigid right at the beginning, or when they are formed, they are not rigid. When they are exposed to certain triggers, for example, if the body gets dehydrated, or when the body level, the water in the body is less, or when the children with sickle cell disease, when they are exposed to cold environment or extremes of environment, say very hot or very cold thermal temperatures, or when they get what is called this infection, or when germs attack them. So these are some of the triggers. Okay, when these things happen, the body thinks that, okay, there is a problem, and the red cells start becoming sickled or abnormally shaped because of their genetic predisposition. And once they become sickled, at a point they become irreversibly sickled. I mean, sickling happens, and when these triggers go away, then they become normal cells. But when these triggers are persistent, then they become irreversibly sickled. That means they cannot go back to their original shape again. And that is when there is clogging of the small blood tubes with these sickle cells happen. And that is when the problems of bone pain, and then chest pain, back pain, and then rapid breaking down of these red blood cells, causing coke-colored or cola-like urine. All this happen because of an acute or a very short exposure to these triggers. So it's very important to know these triggers.
Yeah, you said that they don't just get sickled. It is certain things called the triggers that make them get sickled. And you talked about triggers like infection, dehydration. So what I want to ask is, if a child has sickle cell disease, but is not exposed to these triggers that you talked about, the infection, the dehydration, the other stresses, then the child will not experience any crisis.
So it is sort of preventive measures that will reduce the triggers from causing sickling events. But whether they are exposed or not, there is a low level of sickling happening throughout their lifespan. So there is a chronic inflammatory or chronic change in their blood tubes, chronic change or long-standing change in their blood cells happening even in the absence of these triggers. So these triggers would just aggravate previously existing low-grade inflammation or low-grade changes in the blood, red blood cells. So even in the absence of these triggers, they do have a chronic, ongoing changes in the blood tubes.
Okay. So they will have cells that are sickled on a small level or a low level, but when they are exposed to these triggers that you talk about, then the sickling gets more, and then they can get their crisis. All right.